Great. Thanks for joining, everyone. Happy to see you all. This is we're calling them town halls, but we're going to have some discussion and presentation, and it's titled Exploring Heat Resilience, Scenario-Based Insights and Collaborative Solutions. This is part of a program titled Fostering Collaborations, a symposium to advance equitable heat health actions. And I'm going to go into a little bit about the symposium if you haven't heard about it thus far, and things like that. So in terms of agenda, we're going to do some welcome and introductions. If you want to introduce yourself in the chat, that would be wonderful. Widoshi, if you want to put the prompts in the chat. And then after that, we're going to be going through some meeting objectives, and we're going to present a few case studies and have discussion about those case studies, and then leave you with some next steps. So before I move forward, I'll just introduce our team a little bit. My name is Kat. I'm a senior environmental planner at MAPC, working on this project called Fostering Collaborations. And I'm joined with other folks in MAPC, and then also the BU School of Public Health. So Greg and Zach and Eileen, as you present, you can introduce yourselves as well. So this project is called Strengthening Pathways. It's part of the Doris Duke Foundation. They sent out a grant opportunity, and they collaborated with other health research institutes to fund conversations across the country that advance and identify heat health priority actions throughout the nation. So there are 18 conversations that are happening throughout the country this summer, and MAPC and BU are hosting one of them. And so we are hosting a symposium on June 18th as part of this conversation. These town halls are to prep for that symposium. So instead of us kind of identifying agenda items or predetermining the conversation or what priorities we expect to come out of these conversations, we wanted to talk with practitioners in the field, whether you're a healthcare practitioner, a researcher, municipal staff, work in our community-based partner organizations. And we wanted to hear from you about, challenges, opportunities, solutions that you're seeing, and we can kind of build on those and have deeper conversations at the symposium. So we're going to be taking a lot of these threads and conversations we have today and continuing them at the symposium to identify these heat health research priorities. So that's kind of the overview of the program. So like I said, the symposium is to foster that dialogue that we have been starting to have like today, and to continue to bridge those conversations moving forward. So we are looking to identify the key challenges and gaps that are related to health impacts from extreme heat, foster that dialogue, and engage funders and decision makers in this to advance this heat health research and to advance the community resilience. And we're looking to finally develop a set of recommendations for policy and research priorities that we can implement at all levels, including local and state. So our objectives for today are to do just that, to share about key efforts that you all are working on, whether it's research, planning, practitioners, and to identify these focus areas that we want to continue for the symposium. So we're going to go over a few case studies just to kind of present some information and have something that we can build dialogue onto. And so with that, I will turn it to Greg first to go over our first case study.
Great. Thank you so much, Kat, and good to see all of you. So yeah, let's just jump right into the first one. I'm going to talk a little bit about the 2021 Pacific Northwest Heat Dome. Next slide. So, as many of you can probably remember, this was several days of very unusual heat for the Pacific Northwest, which is usually fairly temperate even in the summer. So, in June, as you see here in the quote from this government report at the time, they're really used to temperatures in the 60s and 70s, depending on the location. And so the temperatures on these days got up to 15 degrees Celsius, hotter than average for that time period. So some real periods of extreme heat, and this extended affected in the U.S., mostly the areas of Washington and Oregon, and then extended up through British Columbia in Canada. And the impacts of this were very quickly obvious that they were quite important. So 250 deaths in the U.S., more than 400 in Canada across British Columbia, and put sort of this unusual stress on hospitals with hundreds of heat-related emergency visits reported just in Oregon, Idaho, Washington, and Alaska. Some of the challenges with this we can talk about is sort of like how do we know that it was 250 deaths? So that's not an easy number to get at. So next slide, please. So some of the analyses that have come up since then, this is one that I really like from some colleagues of ours working at University of Washington and their collaborators. And what you can see here is the number of emergency department visits on average per day for each of the days preceding that heat wave. And so those are the black dots are the observations in the several days before. And then the extreme heat event starts where that vertical dashed line shows up. And what you can see is that on the second day of the heat event, there were some additional emergency department visits, but then on the third day, it really spiked to maybe something like 40 emergency department visits per day, higher than usual. And then when they looked at this analytically, they found about 27 extra ED visits and 9 or 10 unplanned hospitalizations per day during this 3-day extreme heat event. Emergency department crowding and the measures like how long it takes people to be seen and how long it takes people to be discharged from the emergency department all showed significant increases. And you saw that every day, but they saw that particularly pronounced on the third day. Again, you can see the process measures of increased length of stay in the emergency department by an hour during the peak period, and that this didn't impact everybody equally. There were more heat-related illnesses for patients that were older, female, and those with pre-existing diabetes were, in fact, about 3 times more likely to, or the rate was 3 times higher in those with diabetes than other patients. So next slide. So then in a subsequent analysis, again published by colleagues at the University of Washington, they interviewed a number of people that were involved in the emergency response and across different specialties. So ranging from public health agencies and emergency management, both at the sort of governmental or jurisdictional level, as well as within a hospital setting, hospital clinicians, long-term care facilities, as well as home care and hospice facilities and other health services, and asked them sort of what went well and what didn't go well during this period. So these were, qualitative assessments in a number of focus groups. And you can see here that some of the barriers, of course, 2021, we were still dealing with the impact of the COVID-19 pandemic. And so that made it harder to offer some of the support that might otherwise be a little bit easier in that setting. But everybody reported limited staffing, difficulty obtaining resources, and inadequate coordination between organizations. These were really common problems. But then some of the facilitators included things like advanced planning and the ability to access cooling. So not every facility in this area is air conditioned, and actually some of the hospitals reported that the air conditioning just couldn't keep up with those temperatures. And so, it's not a given that even in our core facilities and essential infrastructure that we would have enough cooling capacity. Many of the strategies were not necessarily tailored to the local context. So both local meaning the region and local meaning the individual type of facility or role that the person played. Uh, there was a tremendous benefit of internal and external partnerships that people really relied on those. But again, that became also a vulnerability point because not all those relationships are well established. Not everybody had equal access to the same types of external partnerships and resources. So I think next slide, please. So the question from this scenario is if we had, if this took place here, how would we do? And how would each of our communities do? And how can we think about it ahead of time so that we can do better? And then, Kat, do you want to have that discussion now, or do you want to just jump into have Zach talk about this scenario first, and then we'll just have the broader conversation?
I think we can pause just to see if there's any clarifying questions or comments on these past few slides.
Okay. So one thing I'd love to hear from you guys, the audience, is that's a scenario of a multi-day extreme weather event in the Eastern Massachusetts area. Like, is it obvious that everybody knows what to do? The human health impacts of this was, across the region of this event was really, impressive in a negative way. And, how confident are we as a community of Eastern Massachusetts that we would do better? I'm seeing a couple not confident. So I think that's what we'd love to talk about. So that's an extreme heat scenario. I think that the flip side of that coin is that, yeah, yes, I think so, Sharon. Thank you. The flip side of the extreme heat scenario, where it's an acute emergency and there's an emergency response type of an emergency type of response. The flip side of that is that summers are hotter and longer, even in the absence of these acute emergencies. So maybe, Kat, if you're okay, we can ask Zach to present on this, and we can come back and have the discussion on both the extreme heat events and then just the every summer is just a little bit hotter. All right, great. Zach, do you want to start? Do you want to go back to the previous slide for a sec and
Sure, that'd be great.
Introduce yourself?
Yep. Thank you, Greg, and thank you everyone for coming. My name is Zach Pop. I'm a research data analyst at BU in the School of Public Health and the Center for Climate and Health. And as Greg mentioned, I'll be talking about how the heat has been changing in New England, Massachusetts, and the Boston area in the recent past, and then with a brief aside to talk about what it might look like into the future. So I'll show a couple of different maps and visualizations to show how the summer heat is changing in the New England area. And for those, I'm going to reference the 95th percentile a couple times. That's the 95th percentile for a given year, which generally represents like the tail end, the high end of the distribution of temperatures that are experienced within the year, and aligns roughly with about the 20th hottest day of the year. So when we're seeing shifts in that percentile or the 20th hottest day of the year, that would mean that that it's warmer on those hottest days and that there are even further pushes in the hottest days of the year. So if you took the 5 hottest days of the year, you'd expect kind of a similar trend upward. And this 95th percentile is used often in health analyses to represent kind of that higher temperatures that people have some familiarity with, but that might be more challenging because they're less common throughout the year. You can move to the next slide. And this is showing across states in New England the trend of the 20th hottest day of the year, actually from 1980 through 2022. So you can see that there's kind of this zigzagging with those background lines that represent the temperature for each year. And then a smooth line that's meant to represent kind of the smooth trend, taking out some of that year-to-year variability. And I think that what pops out here is within the last 10 years, you can really see that trend upward, and an increase in the hottest temperatures that are experienced within the region, something that's happening across states. And if you look at that green line of Massachusetts, where there's quite an increase. And looking at the table to the right, specifically for Massachusetts, you can see within the last handful of years compared to the early 2000s, an increase of 2 to 3 degrees for that temperature on the hottest day of the year, which can represent higher heat stress that I think that we were sharing in the chat, remembering over the last couple of summers. Go to the next slide. We can see what this looks like in a map across New England on the left. And you can see those areas that were a lighter yellow or a lighter pink in the early period 2000 to 2004. If we focus on recent years from 2020 to 2022, a pretty appreciable increase across the New England area. Those areas that were blue, and I saw a question in the chat. Here, this is just focusing on air temperature. So the humidity point is well taken, and will be good to produce some similar visualizations accounting for that. Here you can see with just air temperature, those increases, especially in eastern Massachusetts, you can see some of those darker reds popping out. And if we'd focus specifically on the Mystic River watershed area around Boston and surrounding communities, you can see this profound increase in areas that were between 85 and 86, moving up to being closer to 88 degrees, similar to that kind of trend we saw on the table. And just to note that this change is happening across the area, but not necessarily evenly. And with this trend in what the 20th hottest day of the year looks like, you can also anticipate that select a given threshold for what might be impactful for health, whether that's 95 degrees or 100 degrees. This is pushing more days to be over that threshold and potentially be dangerous and leading to those increases in emergency department visits and other health impacts. You can move to the next slide. All right, here just quickly to note, we've also done some work that looks more forward and comparing the period from 2041 to 2060, so around mid-century, to the recent past. And I can share in the chat a link that hopefully everyone will be able to access that would be a more interactive way to interact with some of these data. But to this point, where we're seeing that increase, which might be like 2 to 3 degrees in terms of that 95th percentile, that can correspond to a lot more air conditioning use and a lot more days that are hazardous in terms of the heat, in a much larger way. So just a 2-degree increase when you choose a given threshold can mean here an increase in 8 times the number of hot days that are experienced. And I know that there was also a comment in the chat about the similarities in terms of the built environment between our area and the Pacific Northwest. And I think that's especially a challenge because across the South as well, there's this anticipated increase in heat, but the relative increase where we're seeing like 7 times or 8 times the number of hot days is really concentrated in these areas that don't occur.
Did we lose him?
I think he cut out.
Okay. I think that was his last slide. Is that true?
I think so.
Okay, great. So we can give him a second, see if he jumps back in. He was in the office, so the Wi-Fi should have been stable, knock on wood. Yeah, okay. So I think that brings us to sort of the discussion points on the next slide, Kat. And I think what we see here is 2 parallel conversations. One around extreme heat, where again, what do we do in these emergency situations to help people over a relatively short time frame of say 2 to 4 days? And that's really a different response and a different set of problems and potentially a different set of solutions than it's just hotter for longer over the summer. And as was said in the chat, that, the places that we might have gone to escape this no longer provide that escape. And as well as, it might have used to be that, yeah, it got hot and humid during the day, but then at night you really got a respite from that and you could sleep and, it would cool off at night. And now it can be hot and humid even through the night for, much of the summer or long periods of the summer. And so that means that it's really not like you just put up with the heat during the day and then can sort of recover at night. So these are again two parallel scenarios. And so I'd love to just open the conversation on the Cat. I'll let you guide how many breakout groups you think we need on that. But really, I think what we want to do at the symposium that you're all invited to on June 18th to talk about this is really develop sort of a wish list of what we wish as a community that we had, and working backwards, like what is then the research agenda around that, or the research and translation agenda. What are the tools that we or you need in your hands? What are the insights that you need, and how do we get those to you? So those are broadly the questions we're asking here. So what data or tools are most critical and missing for planning purposes, and for an effective response? Again, under each of these two scenarios, which communities or age groups or other characteristics do you think are most vulnerable? And I think, we tend to sort of generalize on vulnerability and think like, well, it's the, older individuals, or it's people with certain medical conditions. And I think it's probably much, much more nuanced than that. And so I would, love to hear in your communities how you identify who you think is most vulnerable, and then how do you reach them and support them? Because the support structures would be very different for kids in school than for, older individuals at home without air conditioning. Um, and then given the importance of internal and external partnerships, what partnerships do you wish you had? Whether it be with anybody on the call, or further beyond, which are the key partnerships to success here? So, I mean, with that, Kat, I'll turn it back to you.
Great. Thanks, Greg. Zach, it looks like you rejoined. So I'm just curious first, before going into breakout rooms, if anyone has any clarifying questions for Zach on any of his slides.
There were a couple in the chat from John.
And I might have missed an earlier one. I saw one right when I was rejoining about.
Yes, is this just air temperature or does it include humidity? And then John asks, how are the projections in comparisons to other projections cities in the area and state have put out? Oh, thinking about these projections versus more localized projections like the ones that City of Cambridge did, or City of Boston.
And can just briefly touch on that first question about air temperature, and it's a great point. The previous slides were demonstrating just dry air temperature, and integrating humidity to get at heat index is something that we can do with these data, and something that we can definitely explore to see how that kind of trend and change varies. The projections that we were looking at did account for humidity. And I think that each of these different kind of permutations that you might take in terms of how to approach a projection study could lead to some variance, versus kind of the local scale, and would love to learn more about the process that Cambridge had taken. We were looking more at a national scale and using many different climate models and trying to take the median from them in the projection space. And also we're specifically just looking toward mid-century and not specifically at the 2030. So I think that there could be variance, but we would hope that it's generally similar.
Yeah, I mean, I don't want to belabor the point, but I mean, Cambridge and I think Boston and some other cities had similar projections. There were localized downscale projections, but also the state has done projections on a watershed scale, and so the numbers vary, but they're much higher than 8. And so I'm trying to reconcile why there's a difference.
Yeah, so the figure there is based off of a heat index exceeding 104 Fahrenheit. So compared to the 90 threshold, I think that could explain the.
Oh, okay, yeah, so it's the, I see, thanks.
Yep.
Zach, I actually had a question before we go into breakout rooms. I find this graph really interesting where it compares each state, and I'm just curious if you have a sense of like what environmental factors contribute to the disparities between these states, because you know, from Maine 85 degrees up to Massachusetts, which is, you know, almost 90, it's a really big variation. And so like, you know, does coastline, tree cover, you know, amount of built environment, like how do you have a sense of what are the driving factors are for this variation?
Yeah, that's a great question, and happy for others to join in as well. And I think that you hit on definitely some big contributors. The way that we're trying to estimate this is also based on where the population is concentrated. So I think that that kind of proximity to coastline and also, I think in this case for Maine versus Massachusetts and Connecticut, I think that latitude does take in some of that into account in just the more northern area of Maine. If we look at that kind of more visual plot, you can kind of see that gradient come out. But I do think that land cover is also a major contributor, especially around the more developed areas around Boston compared to throughout New Hampshire, Vermont, and Maine, where there would be a lot more forested areas with a lot more green space and blue space.
Yeah, I completely agree with that. That land cover and elevation has a lot to do with it, and distance from the coast. Obviously, Vermont and New Hampshire with a lot more mountains. So we've looked at this in the past, and not in this analysis, but you know, in the New England region, the Connecticut River Valley has some of the highest temperatures in the region, and Nashua, New Hampshire has, you know, repeatedly some of the hottest temperatures in the region. And of course, you know, there's a confluence of sort of a lot of people live there, and so the land cover and the you know again elevation, distance from coast. But it's really interesting. You can really see it when you look into the maps that those two areas, you know, have some of the hottest temperatures in the region.
Great, thanks. Okay, any other questions before we move into about 20 minutes of breakout rooms, and then we'll come back for 10 minutes of report back. Any other questions? All right, I think we're gonna have 2 breakout rooms. So Yoshi, feel free to send everyone into discussion areas.
Thanks, Kat. Opening up the rooms now.
Great. I hope everyone had a great conversation. Ours was really helpful. Wonder if we could just do a couple minutes of report back. I can start with we only had 2 breakout rooms, so I'll start with our breakout room, and anyone who was in our room, feel free to add as well. So a couple things we talked about were you know, how to get people engaged, particularly you know, when we're communicating about certain heat events. It's, you know, a lot of the same, we call them usual suspects who show up and are engaged. And so how can we target that communication so that, you know, folks get the information, but maybe it's a lighter touch and they don't have to you know, give a lot of attention to it, but it's really clear and concise and actionable information if there is a heat event happening. We talked about, you know, some how we have a lot of data, but it's hard to share it and to use it in a way that that's digestible and has equity lenses on it, and things like that. And John also brought up a point about talking about land use versus emergency response, which I thought was really interesting. So if we have tree cover data, for example, that's kind of one side of the conversation, but it needs to be bridged with an emergency response or communication side as well. So, and then a few other things we talked about in terms of equity, focusing or making sure that we're targeting communication to low-income neighborhoods, folks with infants or young children, and that folks who work in home health services industries would be great people to include in this conversation and make sure that they're at the table. I hope that was, anyone from my breakout room want to add anything to that? Great. Let's see, who can I pick on? Greg or Radoshi, anything from your breakout room that you want to share?
Yeah, sure. I'll go ahead. So well, we just had a fantastic conversation. I felt like we could have used another half hour. I think that there's two top themes. One is sort of that despite sort of the recognized importance of heat in this group and in the circles that we normally travel, that the public and maybe our city leadership is still not necessarily recognizing the importance of this. And so one of the questions that emerges is sort of what would it take, what statistics or finding or insights or evidence would it take to sort of bring this to the what we might feel is the appropriate level of attention and resources. And because that leadership is not needed just politically, but in order for there to be a really concrete plan and responsibility for what happens during when something like a heat dome type of emergency here, it's like we need to know ahead of time what would be the actions and how those actions would be resourced. I think a sub-theme of that is that it's as important to identify what we should be doing from what we should stop doing. And so the example of the controversial example of cooling centers talked about that the traditional let's open cooling centers may not be financially advantageous. Maybe that money can be better spent. These things cost resources, and how do we know that they're actually kind of doing the best that we can with those resources versus diverting those resources to other types of response? So the flip side of what actions should we be taking is what actions shouldn't we be taking or are not financially viable. And then I think the third thing that I heard come out is that there's a lot of good ideas, that there's a lot of parallel conversations coming. And one of the things that we recognize and the reason that we're having these workshops and building up to a larger symposium is to try to reduce the number of parallel conversations that are happening, but that these are all well-intentioned and useful in those circles, but that there might be a model where it would be more advantageous to work together and reduce duplication of effort. And one of the examples came up is that in trying to work with healthcare providers and our clinical infrastructure, they might be getting messages right now about heat alerts from multiple sources and with different they're not necessarily received on the same day or for the same type of heat or with the same recommendations of what to do, and that can be both confusing and counterproductive. And should there be one source of information for some of these sort of emergency response activities, one source of information that we sort of make as great as it should be, and rather than potential duplication of effort. So those are some of the key points I heard, but I invite anybody else in our group to jump in and correct or add to that.
Great. Thank you. That sounds like a great discussion. Thank you all for joining. I'm going to share my screen just one more time. If you enjoyed this conversation, we do have another one tomorrow, so you don't have to go too long without us. We have another one tomorrow to continue similar dialogue and set. This will be the final opportunity for you all to provide input and help set our symposium priorities. So that one will be focusing on challenges, opportunities, and solutions and approaches to heat. So tomorrow at 10 a.m., Ridoshi will put the link in the chat to register. And then finally, the kind of main event that we've been gearing up for is the symposium. So we really hope you'll be able to join us on June 18th. It will be at BU's campus, the Center for Computing and Data Sciences. I believe the registration form is in the chat too. And we do have an agenda here. It'll be, the first half of the day on June 18th. And we have an opportunity for folks to share about their work and give lightning talks. So if you're interested in hosting a lightning talk, you can reach out to me at kcobel@mapc.org or any of the MAPC or BU folks on the call. So please do that. But we're looking forward to it, and please share far and wide with your networks as well. And with that, just want to say thank you, and thanks for spending your afternoon with us. And we look forward to, if you're joining tomorrow, to seeing you then. And otherwise, have a great rest of your day.
Thank you.
Thank you, guys. This was great.
Bye,
Thank you so
all.
much.